Hello, family, and welcome to episode 66 of Stand Up. Joining me today, healthcare economist and health policy expert Dr. Austin Frakt, and a whole bunch of listeners who I just called up and had chats with about how they're doing and how they're living through this terrifying, unprecedented experience. Hey, guys, and welcome to Stand Up. This is a podcast to show where we try to learn from experts about the issues that matter most in our lives and what else matters more than the outbreak, the pandemic, which is only going to get worse over the next few weeks and months. How are we going to deal with this? How are we going to survive this? I know how. By depending on each other, by talking to each other, by staying connected, by not letting the isolation and loneliness and fear and panic get to us. That is what I'm going to try to do for you, and thank you very much for all of your support, especially those of you supporting with a paid subscription on Patreon. Go to patreon.com/Pete Dominic, and you can join me in the happy hour, which we experimented with last night. It was a lot of fun. Going to do it again tonight if you're listening on March 20th, 9 p.m., but you got to be a patron to join on Zoom. Me and like 49 of my friends. My wife joined up last night. Had a lot of laughs. It was the most fun I've had in weeks, as a matter of fact. So definitely check that out. You just have to subscribe to my patronage for as little as $5. Patreon.com/Pete Dominic. You can find the link in the show notes. You can find the link at Stand Up with Pete Dominic, PeteDominic.com, PeteDominic.com. Okay, I got a whole bunch of callers on today's show, and I just heard from a bunch of different people in different situations. Some are more scared than others, but we're all in a similar boat, in a similar situation, relying on a number of different sources of information and ideas and skill sets, and that is what I'm going to do first here. Here's a whole bunch of callers coming up right now. Then we'll talk to Dr. Austin Frakt after that, so stay tuned for it. Here now, I'll start with my friend Kaisha, right here in the listener caller portion of today's episode of Stand Up with Pete Dominic. And don't forget, you can watch this as well on YouTube now, youtube.com/Stand Up with Pete. I'll let you know when that is up. I'm done putting that together with a lot of these people I called and a lot of my guests I'll be calling and interviewing on video as well. So check out youtube.com/Stand Up with Pete. Let's do it. Is it Kaisha?
It's Kaisha. Perfect. Yes.
We met.
We met one time at the March for Our Lives. Was it March? What was it called?
That's right. It was March for.
Yes.
No, it was the Women's March, the first one.
Yes. I wasn't at the March for Our Lives.
You were with your husband who was performing, I think.
I was. He was the music director for Alicia Keys.
Thank you for joining me for a couple of minutes. Where do you guys live?
We live in Delaware, right outside Philadelphia.
And you have 1 4-year-old?
I do. I have a 4-year-old who I threw on the computer for a little bit. So I have.
Did you literally just toss him over there?
Literally threw him in the chair and said, "Don't."
Well, if he wants to join us, I don't know if you allow your kids to be publicly on screen.
Listen, we might not have a choice in a little bit. So
yeah. So you and your husband are both artists?
So we're both musicians. That's actually how we met. My husband now is a music director and continues playing. He plays various instruments. And I do the behind the scenes side of the business with, all the fun contracts and paperwork and finances and all that stuff. So it allows me to work from home from that side of the business, which is great.
Awesome. So what is his normal, he's a pretty successful musician, so what is his normal workload and schedule like before this? And is it all cleaned right now?
Most things are shut down. So he was actually on site shooting for a new show last week, and they just got the call that everyone's going home. So everything changed literally in 24 hours. And it's unsure as to when it will start again. And it's hard because it's us and it's all the musicians that we're connected to. As a music director, people and artists come to him for referrals. So it's not just us when we're thinking about projects shutting down. It's us and maybe 20 other people that we refer to the same job.
So what is the conversation with your husband in your home like right now? Are you guys freaking out? Are you kind of chill? Are you, what is your level of anxiety and concern about the next few weeks and months in terms of health and wealth?
We are not freaking out. We definitely are having hope and faith for later on in the year and hoping that third and fourth quarter will bring some type of solvency back to the industry once things calm down a little bit. So we're not freaking out, but it is a huge concern. And not only for ourselves, but again, it's for a lot of people that we work with, because our industry is gig by gig. So you're only as good as that last thing that you did and how much money you made off of that. And
right.
So if you haven't been saving, if you haven't been putting stuff aside, which for a lot of musicians is something that is not a thing that they don't want to do, that they can't do that. It's not, it's not an option. So it's just really hard. We're getting a lot of calls and just concern about, is there anything offline that we can do, or, sessions that we can do from home. A lot of music, which I don't think people realize, is not done everyone in the studio anymore at one time. It's one person does a part here, one person does a part there, and it's put together electronically. So, a lot of that is shifting, where people are trying to do more of that work or get caught up on stuff that they haven't been doing. Some of the TV studios are still, and movie studios are still functioning in the background and doing offline parts that they might have pushed to the end of production and are like, let's do that in the beginning of production now instead.
So you're a mom home with your young son. How much have you thought about what it's going to be like to be basically quarantined with your son and your husband?
Well,
I guess, right? I mean, we're tolerating each other.
I get it. The weird thing is I actually did a live last week on my Instagram because I started getting a lot of questions about homeschooling. So I kind of fell into homeschooling because of our lifestyle. So because at any moment, we might be in a different state or somewhere else, we adapted homeschooling very early. And I have a good network of other musicians and families that homeschool because of that same reason. So your
son is only 4. I mean, what kind of homeschooling? We're just playing in a sandbox and looking at shapes?
It's weird.
What are you doing? Algebra with him?
No, not algebra. He's really advanced, and I try to, this sounds bad, I try to slow him down because I want him to, have
Oh, no, I totally relate. I get it.
I want him to have fun and enjoy life as a kid, but he really loves learning. So I try to just really encourage that. So instead of doing preschool, we did everything at home. And whereas this year he was on kindergarten level, instead of doing kindergarten, we do more stuff at home. But it has, and people are like, well, it's easy for you. You've been homeschooling, but it's hard now because for a 4-year-old, everything is about routine and everything has been canceled, and he knows his schedule. So he was like, Tuesday, we're supposed to go to nature school, and nature school is shut down. And Thursday is swimming, and swimming is shut down. So it's hard. I've spent more time doing check-ins to make sure he's okay than actually doing learning, if that makes sense.
Nah, it does make sense. And it's also really good advice. And I think you could bring nature school inside or bring him out for nature school. And swimming, I mean, he can't be that big. He's 4. Why not fill up the tub and work on some breaststroke in there?
It's a great idea.
I also know, based on our social media friendship, that you over the past, I want to say, couple of years have been training really hard as a runner. I think you've done, I don't know, marathons or halves, but you're often
full marathons.
Congratulations. So my question is, how is your exercise routine going to change, if at all?
It hasn't really changed. That's the great thing about running. So I know it's harder for people that do like weightlifting and stuff in a gym, but we can still go outside. We have still been going outside. So it's been fine. I can still run, outside, and it's not an issue because I usually run by myself anyway. So it's not a real issue. I train from all my marathons by myself. So I'm used to doing 20 miles.
I want to train with you, and I'll have no problem keeping the 6-foot distance.
It's fine.
Like, Kaisha!
I think
breathing, spitting.
I'm hoping that this makes people, like, it'll force people outside. Like, especially if you have a backyard, if you have a front yard, if you have a street you can walk down, like, you need to get outside now. You don't have a choice. And yes, you can stay away from people, but like today, our learning is canceled because it's the first day of spring and the sun just came out and we're going outside. So
awesome. Well, thank you very much for talking to me. It's awesome to finally connect this way. And hopefully I can keep touching base with you and seeing how you're doing, because you're a positive person and an inspiring person. And I love having you on here.
Stay well. Talk to you soon.
Now on the phone is Kenton, who I've met through friends and through Twitter, who I've been commiserating with because we both are in precarious financial situations. And now I've got you on the phone. We've never talked, but thanks for joining me.
Thanks for having me.
So you and I were tweeting before the pandemic started about your precarious financial situation. How are you feeling today, Friday, given everything that's happening here on March 20th?
It gets scarier and scarier every day. The rent is always due on the first of the month, and no one has offered any. Well, I guess New York has offered people some rent and foreclosure protection, but down here,
Where do you live?
I'm in South Carolina.
And you live in an apartment that you rent?
Yes.
So what are your options right now?
I mean, so I've got enough. I've got enough to make it. I guess I can pay rent on the 1st of April, and from there, we will see what happens. At one point it was a consideration that if it all hits the fan, that I could move in with my parents, but my dad's 81 and my mom is older as well, and I don't think that's the right move either. I had a prison style visit with them on Tuesday.
Oh, wow.
Yeah.
What was that? What do you mean specifically? Like you had a pane of glass between each other? You sat in your car? What do you?
Yeah, I talked to him through the storm door. So I sell hemp and CBD products, and so I dropped off a couple of bottles of CBD to my dad, and they gave me a few rolls of toilet paper, and but
I was hoping you were going to say a few rolls of hundreds.
well, they don't.
Let me just overpay you for these couple bottles.
Right. Yeah, no, well, they have helped me out tremendously. So I had a car issue that hit me late last week, first of this week, that cost me
real life.
Yeah, it cost me a few $100s. That they did help me with that, because it's not much else in terms of options for me.
Yeah, you're not alone. There's so many people out there right now that are really living on the edge, paycheck to paycheck, that are working hard through no fault of their own. What about? Can you talk about your child situation?
Yeah. So, and funny enough, so I'm divorced, and that was not a fun process. And so, but I've got 50-50 custody of my son, and look, it may come down to I might have to. We haven't even really discussed it, but I might have to I don't know, like, move back in with her, or at least she's got a detached unit at her house. Like, I might have to move back into she calls it the mini house. I might have to move in back there.
The mini house it is, Kenton. That sounds like not a perfect solution, but I see you in the mini house soon, and we'll podcast from there, brother. We'll stay in close touch. Listen, I'm doing these short hits with everybody. I appreciate you letting me call you. I'll be checking in with your situation, and we'll try to continue to find ways to support each other. I know it's terrible, scary, and unprecedented, and you're not alone, man. So I appreciate you talking honestly and openly with me right now.
Hey, can I add one more thing?
Yep.
Lindsey fucking Graham is a piece of shit, and he is resisting paying. He's resisting giving direct payments to the American people. He wants to bail out businesses, of course. His Greenville, South Carolina office number is 864-250-1417. I actually spoke to a human rather than the machine that normally answers his phone if you call his DC office. But yeah, Lindsey Graham has got to go.
I love that that's the thing that you had to add. That made me laugh. Kenton, thank you. Good luck, buddy. I'll talk to you soon.
Thank you. Bye.
All right, I've got Cameron for a couple minutes here, and you've got a pup there in Arizona. Where in Arizona?
Phoenix, Arizona.
And what's your dog's name?
Joey.
Who do you live with?
My wife.
No kids?
No.
So right now you're full-time in school and driving Uber, is that right?
That's correct.
How are you doing right now? How is school? Is school shut down? And is Uber good or bad right now?
Well, that's the big question. So, I'm kind of getting into that position where what you mentioned the other day on your Twitter, everybody's getting shut down. School right now, luckily I'm online, and so I can continue to do my schooling. Uber, unfortunately, I'm going to find out this weekend when I go out to work, but it looks like I'm pretty much going to be out of a job for a while.
Because no one's needing a ride, and even if they do, they don't want to get in the car with somebody kind of thing?
I don't think it's a matter of not wanting to get in the car. It's just our governor, Ducey, like everybody else, is
Shut it down.
Yeah. So, yeah.
How do you feel about your state government's leadership? How do you feel about the president and the congressional leadership?
So state government, I think they're doing a great job. They've really kind of just, done what they have to do. They're shutting things down. I'm okay with that. It is what it is. We're all in the same boat. On the federal side, I am not a big fan of the president, but I think overall, they might have started a little slow, but I think they're getting things done, and they're offering, people like me a chance to get through this.
What is your biggest fear and concern?
That everybody's not going to pay attention as a whole, and they're going to go out and play. You see all the Twitter feeds of all the kids still doing spring break and stuff, and it's just stupid. I mean, we got to lock it down and take our punches.
All right, man. Well, you seem like to have a pretty good attitude. Are you, how would you describe your general personality in terms of anxiety and concern, and how are you coping?
Personally, I think I'm coping pretty good, but I'm lucky. I got a pretty good family base, and I got a chance to get out of this financially, even though I don't have a ton right now, but I do have a good background. So I'm one of the lucky ones. So, as long as I keep doing my school and I get a little bit of money, I'll be okay.
That is Cameron in Arizona. He's a student. He's driving Uber, and we will check back in with you again throughout this, man. I appreciate you doing this. Thanks, Cameron.
Thanks, Pete.
All right, now I've got Iowa State Senator and old friend of mine, Zach Walls, joining me. Zach, where exactly are you in Iowa?
So I live in Coralville, which is right kind of in the heart of where COVID-19 has the biggest presence in Iowa. Coralville's in Johnson County, and our county has, I think, just over 20 cases of COVID-19. The outbreak here actually started with a local bank. A bunch of executives and shareholders, a relatively small community bank, took a cruise in Egypt. And while they were there, something like 15 or 16 people contracted coronavirus, came back, tested positive over the last few days, or I guess the last almost 2 weeks now. Sorry, time has taken on a very peculiar quality, which I'm sure is a universal experience for everybody at this point. And as a result, community spread is currently underway here. I literally live across the street from one of the clinics of the University of Iowa Hospitals and Clinics system. And so we know that there are a lot of efforts underway at UIHC right now to preserve medical supplies, so specifically personal protective equipment, which is going to be exceptionally important over the next little while.
Yeah. So you are part of the Iowa state government, and what is your role and what is the government role? How are you guys handling it right now?
So we actually, the legislature took I think it's the first time this has ever happened. We actually passed on Monday legislation to suspend the legislative session for 30 days. This time a week ago, the majority, so I'm a Democrat, we're currently in the minority. A week ago at this time, the majority was kind of saying business as usual, there's not going to be any changes. And that's how quickly this is moving, that, last Thursday, last Friday, it was kind of business as usual. And by Monday, we were up until 1:30 in the morning, passing emergency continuity of government legislation to suspend the legislative session, to give the governor new executive authority to both spend funds and issue proclamations, and then also making some emergency supplemental appropriations to things like Medicaid to try and make sure that the money is able to continue flowing if, God forbid, things go wrong and we're not able to reconvene in the next 30 days.
Do you think, what are you hearing from your constituents? I mean, what kind of calls is your office getting, and what are the concerns? Because I would imagine right now everything seems to be about both health and wealth. Some people obviously prioritizing because maybe they're in good health and they don't have anybody that they're necessarily concerned about. They're thinking about their mortgage. They're thinking about their job. But I'm sure you're getting phone calls on anything from mortgage suspensions to where is my test? Who is calling your office, and what are they saying and asking? What's the tone? Are people panicking? Are they mad? Are they?
There's a lot of concern, no doubt about it. So I'm hearing from probably 3 different groups of folks. The first are medical providers who are really worried about, first, the lack of tests, and second, the lack of personal protective equipment and some of the measures that are being taken to conserve that equipment that we do have in stock. The second group of people who I'm hearing from are a lot of small business owners who, if you own a restaurant right now, you're a small business, you're really in a rough spot. And then the third is obviously people who are employees, everyday Iowans who are worried about their paycheck, who are worried about making rent, who are worried about making the mortgage payment. This morning, several of us have been calling on the governor to suspend evictions unless there's a clear and present danger. One of the things that we know happens nationwide when we have this kind of situation is that domestic abuse spikes. And so it is important to be able to move forward with some eviction proceedings that might have already been kind of planning in place to try and get somebody out of the home. But if the situation is an eviction because of a landlord who doesn't like a tenant or something that doesn't meet that clear and present danger threshold, this is not the time to be throwing people out of their homes. Just yesterday, I was working very closely with their local homeless shelter. And one of the things to understand about a homeless shelter, and one of the reasons why we've seen some states take very dramatic action to support the homeless population, is that a homeless shelter is essentially a nursing home where the residents wander around in the community throughout the day. And then they kind of come back in the evening for shelter. And so making sure that we're supporting folks, especially including those who are the most vulnerable among us, is important, not just for their health, but for the community at large.
Oh my gosh. How are you dealing with this? You're a very smart guy. You're confident. You're calm. What are your fears? You're newly engaged. Did you get married yet?
Our wedding is set for September, so we haven't gotten married yet. We're hoping that we don't have to postpone or delay, and we're kind of dealing with that day by day. In terms of staying calm, just trying to exercise daily, get enough sleep, eat relatively healthy, and just kind of, again, take it day by day. I would say my greatest fear is I've been reading very closely what's happening in Italy and what's been happening for the last week or so, and it seems like they're in hell right now. And my biggest fear is that is the direction in which we are headed. Not just, in Italy, it's kind of concentrated mostly in the northern part of the country, although it seems to be spreading, and we're seeing some things happen now in France. The biggest concern that I have is that we find ourselves in a similar situation as Italy, because that could be, it would be life. This is already life altering for so many people, but compounded by enormous loss of life.
When does the state of Iowa reach out to the National Guard, and how are you guys dealing with the federal government, if at all?
Yeah, so there are currently no plans to activate the Guard, although of course that could change. Again, a week ago, there was no real talk about suspending schools, and on last Sunday we were suspending schools for 4 weeks. So things are moving very, very rapidly. I don't know what the timeline would be on something like that, or kind of what would trigger that decision at this point. The governor has the authority to make that decision, so she can do that here. In terms of the federal government, my understanding is that the biggest problem that everybody is having right now is the lack of tests. And because there are not enough tests available, that basically means that we're flying blind to some extent. The state of Iowa has 3.1 million people. We've conducted a total of about 650 tests. About 44 of those now have come back positive. About 600 have come back negative. And so, but we got 3.1 million people here. We know community spread is happening. And the lack of tests in the state means that it's going to be very difficult for us to get ahead of this, which is why it's so critically important for people to stay the fuck home. I cannot stress that enough. If it is possible for you to do so, if you do not work for an essential business, If it's possible to work from home, please do that. It's so important, especially in communities where we know community transmission is underway.
All right, man, I'll check back with you next week. If I was a constituent in Iowa or even now, I wish you were my state senator. Good to have you, buddy.
I
Thank
appreciate
you very
that.
much.
Godspeed,
right.
Pete, and I hope you and yours stay safe and healthy.
I'll talk to you soon, buddy.
Sounds good. See ya.
All right, I'm now joined by my friend Cornell Woolridge, who lives down in Austin, Texas, where he works as an operations manager for Princeton Review. He's also on Twitter at Renaissance XM, and check out his nonprofit at Civic Solve, which is trying to get people more engaged in civics. Hey, buddy, thank you for checking in with me.
Hey.
How are you doing in Austin right now? You live with your wife, right?
Yeah. It's weird. I actually, we've been staying inside and all that. My wife actually has a condition, epilepsy, that makes it so she's in a particular, kind of vulnerable situation. So if you have epilepsy and you get a fever, that actually is worse for your epilepsy because it lowers your threshold for seizures. So your seizures become more and they become bigger if you have a fever. So we've been, practicing the physical distancing for a while, but I actually just went to the store this morning, and it usually takes me like 30 minutes to get in, get out, because we don't usually get tons of stuff. But it took me like at least 45 minutes because I was trying to like roll my cart, but stay 6 feet away from people. And like, I haven't been that panicked going to the store in a really long time, just because it was like, okay, I'm paying attention. A lot of people around me aren't. And so I'm like dodging people. And it's just kind of crazy just to have something that simple, going to the grocery store, be like a harrowing thing.
How worried are you about your own financial situation?
I am right now. I'm in a fortunate situation because I'm able to do my job from home. We actually went remote on Monday. Some of us have the ability, in my office to work remote because they work in marketing. So they work remote most of the week because they're out and about meeting with people. But those of us that work in operations, we're generally in the office and we make sure the office is going well. But we all went remote starting Monday, and I'm really fortunate to have a job where I can do my job from my computer and I can connect, to customers and families, via the phone system that we have that can go remote. So I'm really fortunate right now, and we're actually in a pretty good situation as a company because a lot of what we do, which is test prep, we can do that online. So we've shifted all of our stuff that was in person online. So yeah, we're certainly going to take a hit like everybody else, but we have the ability to shift in some ways to make it not as bad.
Do you feel like you have enough supplies if the National Guard comes in and shuts it all down? I mean, you do. I see that you have a cooler up over your right shoulder on the bookcase in there.
Yeah, I mean that's that we haven't used that in a while, but
might want to pull that down. And I don't know if you can eat books or not, but you should be okay if that's the case.
Not so much, but I mean we've been since like last week. I felt this was going to be pretty significant like weeks ago because I was hearing stuff about it in China and even before really anybody for the most part here was saying, hey, this could be bad. I've been paying attention. I'm like, okay, if this gets over here, this is going to be bad. So we've been like slowly but surely kind of stocking up on things, and I think we'll be fine. And I think for the most part the country will probably end up being like what California is doing right now as far as the shelter at home. I don't know that it'll get so bad, at least not yet, as like, hey, you cannot leave your home really for any reason other than like an emergency. I'd say we're probably a little ways from that, but we could get there. And so I think right now we're good for, probably, like 2 or 3 weeks, maybe a month. As big as I am, I actually don't eat as much as it might seem like I could. and my partner, she has a particular diet where there's only so many things she can eat. So overall, I think we're in an okay place.
All right, buddy. I'll check back in with you very soon. I appreciate you checking in with me here, and
no worries.
Stay safe.
All right,
pal.
you do
Love
same,
man.
Pete.
All right, later.
All right.
everybody in my house is doing a meeting right now. So.
All right. This is Veronica. She is in Albany, and she is an office manager of a dental practice, and she wears a fan on her head. That was really screwing me up right there.
Yeah, sorry.
No problem at all. Thank you for joining me.
No problem.
You live in Albany, New York, and you're sheltering at home. We just got the notice before we went on that the governor of New York said all essential businesses are shut down. When did the dental practice you work at shut down?
We sent everybody home, most everybody home on Tuesday morning. And then myself and a few other employees stayed until yesterday. We had planned to keep a few more people working next week because we're not sure. We're not getting any guidance. So we're not sure if we're supposed to still be open just for emergencies, which is what we've been doing this week.
How many dentists?
An obligation to patients to treat them if they have emergencies, and you can't send them to an emergency room right now. So we're kind of in limbo, and we really haven't gotten good guidance from anyone as to what we should be doing.
How many dentists in that practice?
4 dentists, 5 hygienists. I have a total staff of 18.
How is your community there? What part of Albany? Is it right in Albany, New York?
Yeah, we're just in a suburb of Albany. Yeah.
How does your community seemingly react? Your friends and family reacting to all this?
Well, you can't find a square of toilet paper anywhere.
Okay.
That's everywhere, I guess. Most people seem to be staying home. There's very little traffic out. I did go to the grocery store this morning for some basics.
Yeah, what was there?
Well, our local stores have offered from 6 to 7 in the morning just for seniors and those with disabilities or compromised to shop when there's less people. But there was a fair number of people there early in the morning.
Did you keep your distance? Was everybody keeping their distance at the grocery store?
For the most part, yeah. For the most part, the malls are shut down. The restaurants are only doing takeout. It's pretty much everything's closed.
Besides your lovely ceiling fan, who are you with in that home? Who are you sheltering with?
So my husband, who does IT for a local school district, he's been home since Monday. And so he's got 4 laptops set up on my kitchen table, and he's providing IT support because the teachers are all doing distance learning. And my 20-year-old daughter, who is supposed to graduate from Siena College this May, hopefully she still will, because she's supposed to go to graduate school in Rochester in August. She has a student assistant program job with the state, so she's working remotely as well.
So your husband and your 20-year-old daughter are there with you?
Yes.
And how do you feel like the state government is doing? How do you feel the federal government is doing and the Trump administration are doing?
I have to say I've been very impressed with Governor Cuomo's daily briefings. He's kind of a no-nonsense kind of guy when it comes to this, it seems. Yeah. He's really staying on top of it. He's trying to make the hard decisions. I do not feel the federal government has been as quick to respond. I'm not crazy about the responses we get. For us in dentistry, we have no guidance because the CDC doesn't tell us anything. American Dental Association can't mandate us to do anything. They can just recommend. So, and, people are like, oh, but why aren't you open? I'm sorry, we're looking in your mouth where the germs come from. And we are not 6 feet away from you. We are 12 inches away from you. So, it's tough, and my boss feels horrible that he's had to lay people off, and it's just temporary, hopefully. But, we're a family. We're a small office. We all know each other and hang out together, and it's murder because he still has to pay his bills.
Yeah. A lot of people in that.
So we're not making any money.
All right, Veronica. Well, thank you for checking in with me. I will check in with you again, maybe this time next week, maybe sooner, maybe later, but I appreciate you doing this. And you seem like a really cool, positive, good and kind woman. So thank you.
Well, thank you. I'm doing my best, brother.
And we all are. All right. Thank you, Veronica.
Thanks, Pete. Take care.
All right. Thank you to all of my callers, my guests, for helping us understand that we're not alone, and for commiserating and supporting each other. Is really interesting to hear all of those stories. If you want to contact me, you can DM me on Twitter. You can email me, standupwithpete@gmail.com. I'll check in on you, see how you are doing. Now it's time for my featured guest for today's episode. My expert guest is Dr. Austin Frakt. I learned of his work from our friend Dr. Aaron Carroll, who joined forces with Austin to create a healthcare blog over 10 years ago called The Incidental Economist. Austin is now the director of the Partnered Evidence-Based Policy Resource Center at Boston's VA healthcare system, United States Department of Veterans Affairs. He's also an associate professor at Boston University, an adjunct professor at Harvard University's T.H. Chan School of Public Health. Here's my conversation with Austin Frakt, which I just pressed record in the middle of our conversation about when I found out, I think he had solar panels, and then we jump into it after that. Here it is.
It's all good.
No, everything looks good. There are solar panels on that house?
Yeah. How do you know?
Because you got them before me.
Oh, wow. You have a memory that's amazing.
Well,
you have a good memory.
I remember things that arouse me, and renewable energy arouses me.
Okay. Yeah, we have solar panels. It's got to be. When did you get them? Do you remember?
I don't. A few years ago. You got yours shortly before mine. I'm sure of it.
It's got to be close to 10 years now, maybe 8, 9. I don't know. I'd have to go back to the archives.
All right. Here we go. You ready?
Yeah.
Let's talk about healthcare, health economics, and what this crisis exposes in terms of what the hell is wrong with our system, which is a lot. I've got the great Austin Frakt joining me. You can check him out, of course, at The Incidental Economist. He is a contributor to the New York Times. Upshot, he works with my friend Dr. Aaron Carroll. He is a health economist now. Are you still at Department of Veteran Affairs? Thank you for joining me, Austin Frakt.
Yes. Department of Veterans Affairs, Boston University, and Harvard University. I've got multiple affiliations.
Multiple affiliations with all of those places, and I just wanted to start by thanking you for wearing the requisite hoodie with white laces.
This is one of my home outfits, and I get to wear my home outfits all the time now. So,
how often did you work from home before you were before the new world began?
Once a week. So I had some of the habits and infrastructure in place, but this has changed a lot.
You have, before we get to all of the things that you really write about, that you're an expert on, I think you asked a question in a tweet, and I have been asking the same set of questions, and I wanted to just start our conversation by seeing if you have any answers yet. You wrote, and you are on Twitter at @Frakt, right?
Right.
AFRAKT. Definitely follow Austin. You wrote, I'm obsessed with these questions. How will it end? What will society look like? What will be the lasting effects? You're actually uniquely equipped to answer in terms of the healthcare, things that might happen, might not happen. But do you have general answers yet, Austin? I mean, those are the three questions. I think you wrote them perfectly succinctly. How will it end?
Yeah.
What will society look like? What will be the lasting effects? What are your guesses right now at the very beginning where we're at?
Well, what motivated that tweet was actually something I was afraid to say, which was more of a clarification. And then I think this hit me really hard a couple of days ago, which is the only way we get through this pandemic is to get to herd immunity. Mm-hmm. And we've all heard about flattening the curve.
Well, not enough people.
Not enough. Okay. Many people have heard about flattening the curve. When you think about flattening the curve, I think the first thought is okay, we want to get the peak infection rate down, spread it out, not overwhelm the health system. Yeah. Some people get that, and that's all good. But what's not really so explicit is that it means the same proportion of people are probably going to get it. It's just a matter of when, because you have to get to herd immunity. The only way we're safe, you can be safe in one way, which is literally nobody has it. That was the world 4 months ago, 5 months ago. But you can be safe in a world where 70% or more of people have had it, and then they have immunity and we have herd immunity. And you can be safe if we get a vaccine, but that's a year to 18 monmonths out.
Why does herd immunity matter so much?
Well, once you have herd immunity is kind of what you get when most people are vaccinated for something. So enough people have the antibodies for viral infection that it just can't spread.
Once herd immunity means all these people get it, and so they can't get it again. They're now immune. It's once you get it, it's like getting a vaccine if you survive it.
Right.
Okay.
Right. That's what we think now. I mean, I'm not sure. This is a good question for our friend Aaron Carroll. I'm not sure it's completely known if you can't get it again. I think it's strongly suspected you can't get it again, just on what we know about other coronaviruses. This is not the only coronavirus. We're in big trouble if you can get it again, but hopefully you don't, and you get it once, you get the antibodies, you're good, you don't spread it anymore, you're part of the solution, basically. So
what were your questions? I'm sorry I interrupted you there. In terms of what were your answers to those questions?
So it dawned on me that we have to get to herd immunity one way or another. We could do it fast, we could do it slow, we could do it with a vaccine eventually. And so it's just okay, we're kind of in this, preferably we do it slow enough to not overwhelm the health system, which means this is going to drag out for months. I don't know how long. And then it started dawning on me, how long can we keep this up? How long can we stay in our homes? How long can we not go to school? Not that long. I mean, in this society, it's going to be tough.
Do you foresee anything in particular about what makes it tough? I'm struggling with my imagination in terms of what are going to be the greatest challenges for families and communities and, of course, individuals.
Yeah. I don't know if you caught the post I put up yesterday on my blog, The Incidental Economist. This goes right to your question, and I encourage people to look at it. I've talked to a number of friends and colleagues, and everybody's in a different place mentally with this crisis. Some are focused on the short term and what's going on right now. That's totally fine. And that's kind of where the media is, which is normal. And so they're kind of in stride with a lot of people, and they can kind of feel some sense of community and support. It's like a shared experience. And then there's those of us, and I'm one of them, who likes to think way ahead. And we feel very alone. That's what my colleagues tell me. I feel alone with these dire thoughts. I don't want to express them and freak people out. Some people I tell, and they're like, dude, that is not going to happen. That's so far off. And so I just wrote a post saying, all your concerns are valid. You're not crazy. Some people were like, am I crazy? I'm like, no, you're not crazy. You're just feeling alone. And the best thing you could do, in my view, and I'm not a mental health professional, but this is just my life. If you're feeling crazy with your thoughts, find someone to talk to.
Yeah.
If you can get what you need from a friend or colleague, do that. If you need professional help, get that. But don't sit there and just go nuts. You're not crazy. This is tough.
Yeah, that post is called Your COVID-19 Thoughts Are Not Crazy at the incidentaleconomist.com, written by Austin, and you've got the Japanese tsunami wave art embedded in. And I feel I feel like we're hearing that metaphor a lot, where the water is still going out right now and it's about to come back. Is that what that is about? And can you explain that metaphor?
That came from a chat with a friend. I think I acknowledged first on Twitter, and then we connected. I said, one of my classes of anxiety dreams is a tidal wave. I have it now and again. And it just is a signal that I'm going through some anxiety and there's something overwhelming. And that's the metaphor for what we're there is a tidal wave coming of infection, and it's huge, it's wide, it's going to sweep over us. We are going to come out the other end. Yes, there will be illness, there will be hospitalization, there will be death, but we're going to make it through as broadly as a society. I'm confident of that. We're going to go through some pain.
So
definitely.
Let's talk about the healthcare system. It's kind of fascinating to see the debate that you've weighed in everywhere that you are heard and can be heard and seen, including at the New York Times, where you've been talking about what's wrong with the healthcare system for years and how to fix it. And you have examined, of course, the plans from all the Democrats running for president and talked and written about Medicare for all. It's fascinating to hear that debate unfold, healthcare still being a prominent and important discussion in America, and then see the pandemic outbreak bear thin all of the rips in our safety net. What do you think has been the most exposed problem as a result of this pandemic?
Well, there's a lot of problems. I think it's hard to pick one because it kind of shortchanges another.
Name a few things that how vulnerable we are as a result of our broken healthcare system. I think
just general preparedness in the infrastructure sense. This has nothing to do with coverage and so forth, which is important, but just having either the emergency stock of the right number of ventilators and other hospital equipment, or the ability to ramp up rapidly and do it in anticipation of a known problem. Look, we know, like public health, global health experts knew this pandemic was not going to stay in China. They knew like it was going to sweep over the world eventually. And we could have gotten up to speed in terms of what we needed months ago.
Yeah.
And we didn't do that with testing, with equipment.
Very frustrating.
And we're starting to get there. Yeah, we're starting to get there, but it's a tight race, you know, and it's very stressful. You know, if I got sick and had to go to the hospital, or a family member or a loved one, you know, I don't know if they're going to get what they need. I don't know if the infrastructure is there. That's another stress we don't need. So that's a huge one. But yes, people who are lacking insurance, lacking access to care, don't have a usual source of care, don't know what to do with their symptoms, you know, are potentially getting hit with bills. Now that's getting addressed with some legislation. But again, it's all on this like emergency basis. We don't have that in place. And I do think there's a huge mental health component to this. People are incredibly anxious. I'm sure people with pre-existing issues are spiking with depression, with anxiety and so forth. We have a very thin mental health system here. Like it's very hard. I mean, I know this from personal experience, very hard to get help when you need it. Takes months sometimes to get it. Yeah.
Throw addiction in there, which you've written a lot about.
Addiction, absolutely. Self-medication. I'm sure that's happening. I think this is not as serious, but I think we're all going to get a little fatter sitting around in our homes.
So, yeah,
but actually,
I'll tell you,
to be a little more serious, I mean, not having that outlet of exercise, going to the gym, I miss that. You know, it's tough.
Yeah, I'm currently making videos where the theme is literally I go to the camera after I do an exercise and I say, "Wah, you can't make it to the gym." So I'm showing people how to work out. My wife is a personal trainer. She's training people virtually. And I think because I've been working from home for the last 4 months, every day, I've changed. I'm uniquely equipped to try to help people that exercise is so important. There's so much that you can do with a very small amount of space. And then getting outside is also really good for your mental health as well. But, you know, while I mentioned addiction, you mentioned anxiety and depression, you and Aaron Carroll wrote this great piece about for the New York Times Upshot about Alcoholics Anonymous and how a new systemic review has proven, systemic review, you can explain, I guess, how it looks at all the studies, that AA really works. Not for everybody, not all the time. And there's a bias because the people that go to AA want help, I guess. Mm-hmm. And I'm sure there's other caveats that I should include before I throw it to you. But I think virtual AA is going to be a really important thing because people are going to be struggling wanting to have a drink. Yeah?
Yeah. I mean, people have used AA, you know, probably will say, hey, I already knew it worked because it worked for them. But in terms of like rigorous scientific evidence and research, it turns out we actually didn't have strong evidence that it worked, you know, until over the last 10 years or so. And the reason is that you mentioned this selection issue where people who go to AA self-select, so they are more motivated to make change and so forth. And it's not clear what's happening, whether it's the program or the people that are making it, you know, making a difference. So anyway, the systematic review said, yes, AA works. You know, if you need help, get yourself to meetings and so forth. But in this era of COVID-19 right now, with, you know, it's hard. We shouldn't be getting to meetings. So it will have to go virtual. I'm not familiar with what AA or different AA like groups have done virtually, but I wouldn't be surprised if it's already happening.
Yeah. And the one-on-one conversation, I almost think that we might be talking and communicating more as a result of this because, as you mentioned, the isolation and how that depresses people. Like my friends and high school friends and I went on a Zoom chat like this the other night for the first time. We've never done that. We're on a text chat, but we've never done that. I think we'll probably see a lot more of that, and I suggest that. But Austin, getting back to our healthcare system and what wreckage this pandemic lays bare about it, is there any way for you to compare how the United States healthcare system, hospitals, doctors, physicians are dealing with this pandemic differently than, say, China has, Italy has, Canada, Australia are?
Yeah, I actually haven't done that survey, but you know, the little I know, I mean, first of all, the other countries you mentioned, you know, have universal healthcare. So that's one issue you can take off the table. Elsewhere, it's just in terms of like people feeling like, oh, I can't afford to go to the doctor. You know, I'm not used to going to the doctor, that kind of thing. That's not an issue there. We have that issue big time here still, even after the Affordable Care Act. So that's one big difference. Then just in terms of infrastructure and preparedness, I mean, China's done a super job. You know, they've done things that really, I mean, just are frankly incompatible with like what we're accustomed to in the U.S. in terms of like complete lockdowns and that kind of thing. So I just don't think we're gonna get there in that level of control.
No, we've got young people still partying on the beach for spring break, whereas China, they have like, you know, drones flying over saying, "Get inside, stupid." In Mandarin.
So I mean, we're gonna do it our own way, for better or worse. And we will get through it. It'll be very messy. I hope we don't get to the Italian level of just tragic decision making in hospitals where, you know, you're weighing the life of a 65-year-old versus a 40-year-old, and like, okay, you don't get the ventilator, you do. That's super tough.
You don't think we're going to get there?
I think we might get there.
Yeah.
I just don't know. I haven't. I've heard stories of like, you know, oh, it's getting tough. It's a little overwhelming. I haven't heard. I mean, maybe you have, but I haven't seen like the stories like, look, this hospital is completely over. Like,
not yet.
We're having to ration care. Yeah, not yet. We may, and it may be spotty in different areas. It depends how quickly we can catch up in terms of what we know we'll need.
What about just you study obviously healthcare economics. Hospitals don't have and don't want empty rooms, empty beds, especially not empty ICU beds. They want to keep them filled. It's like a garage with cars in it, I suppose, if I could be less brutal about it, just to look at the economic effect of it. Is that uniquely American? Should there be, you know, a place or extra stock of things like ventilators and ICUs? I mean, I understand why Florida's government doesn't invest in snowplows. They don't get snow. Yeah. So I understand why hospitals don't invest in all of that extra gear if it's not going to be used. How should that work?
It's a tough decision, and yeah, you're right. I mean, hospitals, we have a private health system where, you know, making a profit or at least making revenue to meet your expenses if it's a not-for-profit is necessary. And hospitals are frankly not going to do that if they have a lot of extra capacity. They don't use that, costs money. So, I think the answers are, you know, to be, you know, prudently prepared in terms of equipment. Of course, if you ramp up and make a lot of equipment and then store it, you know, it gets old, it doesn't work, it is out of date. So like there's a trade-off there. But the other thing is, I just think, you know, like I said, we could see this coming like 4 months ago. And the answer was, let's start getting ready now, not wait 4 months and then try to catch up.
Right. What else do you think? Before I want to get to your piece from the New York Times about you and a bunch of other healthcare economists went to some conference, and I want to talk about the outcome of that. It's really interesting. Also, I want to just make fun of how boring that conference must be. But maybe I'm wrong about healthcare economist types. But is there anything else that you're thinking or seeing right now in terms of what this pandemic lays bare in terms of, what else you got? What are the
this is a little bit outside the health. Well, it is outside the health system, although it's not relevant to health. I have kids. I have a kid in high school, kid in middle school, public school. Public schools, not private schools, but public schools are actually really struggling. Because, you know, their mission is to provide education for everybody. That includes people with special needs and special programming, which they can't do remotely. And the consequence of that is they're not really sure what they can provide remotely. Like they can't do online classrooms, you know, if not every family can take advantage of that. So if this goes on long enough, it presents an educational crisis on top of a health crisis. That's one thing for young people. The other thing for young people that troubles me is that we all remember being young. Being engaged socially is like your life when you're, I don't know, you're like 12 to
I have 12 and 15-year-old daughters.
Like, I can handle being home alone at nearly 50. Like, I'm cool. Like, there's no problem. But
me too.
But my teenagers are like, I got to see my friends, and I'm very sympathetic to that. Like, that's super hard. Like, that's what they're supposed to do at that age.
Yeah, they're supposed to socialize. I wonder what the difference between seeing and spending time and hanging out with their friends is. And I've always wondered this, though, long before this, and the socialization that they get on FaceTime. They only FaceTime. Like, my daughter never calls me on the normal phone audio. It's always FaceTime. They always see each other, and so they pick up, you know, facial expressions and conversation that way. Sometimes they have a bunch of people on a FaceTime or something. And so what is the difference between physical connection and this kind of virtual connection? I don't know. They're certainly not going to be able to sneak out. What are they going to drink in their bedrooms, respective bedrooms, where they spin the bottle?
Well, the irony is, like, you probably experienced this too. Like, we spend so much time as parents, like, get off the screens, like, go outside, read a book, blah, blah, blah. And the funny thing is, like, in a funny way, we've been like almost preparing our kids for exactly this situation for the last 10 years. Like, they're all into it electronically. And, but still, like, my kids are saying, like, I kind of miss going to school. I want to see my friends. That there is, at least for my kids, like, they still have that little bit of need for that, to be together a little bit. Maybe not as much as we had when we were growing up, because that's all we had, but they want it.
I haven't even started, by the way, thinking about my daughter's education. I don't think their school has it together quite yet. Just today, they had their like first Zoom conference like we're doing now. But all these parents are, and I'm going to have conversations with people who are online education experts about it, but a lot of parents are wondering, or I see a lot of parents already sitting down with the table with their kids, and I'm like, I don't. I think next week I'll start looking into that. But I'm trying to figure out what the hell is going on and get comfortable with some type of a routine before I force the schooling part of it, which I don't. I'm trying to let the school take the lead. I'm hanging back on that, is what I'm trying to say. I'll wait till next week.
Yeah, we've been searching for routine, and I'm just getting it. It's like, so I had a regular gym routine, and I'm going to catch you out after this to ask for help with this. But like, I'm trying to do stuff at home, and every day I'm alternating things. But I finally like, okay, this is my hour in the morning. I'm going to do that. We have our kids make checklists every morning. I put because I'm still trying to work. I put in the kitchen a list for my kids of like when I'm busy and when I'm free for the day. So I'm like, if you need help with homework, you want to go do exercise with me, we're going to do some cooking, like whatever, play game. Like, I want to be there for them too, so they know my schedule. Like, these are like little things we're putting in place.
That's really good. That's very organized. I'm nowhere near that. That's good. That's inspiring.
Just some tips.
Yeah. All right. I want to ask you about the healthcare system we'd have if economists ran things, Austin Frakt. You have a great piece with that title at the New York Times, where there was a conference, y'all got together, and a survey of nearly 200 health economists with PhDs weighed in on a whole bunch of different issues. And it's super interesting, this article, for a lot of different reasons, because you write about so many different issues that you all took a look at. But what is it like, first of all, socially, when 200 healthcare economists get together? I mean, does it get crazy? Do you guys start doing keg stands? Is there a lot of nudity and scandal?
It's all math. We just talk in math.
Yeah.
No, actually, so this conference is bigger than 200. I don't know the numbers, but I think it's more than that. The survey was of 200, prior, and the survey was presented at the conference. And actually, normally the survey ends up in a peer-reviewed publication. I went up to the folks who were presenting. I said, "Are you going to publish this?" They said, "We're not really sure. Probably not." I was like, "Hey, if you want it in the New York Times, like, I'll run with it. I think it's fascinating."
All right. So they gave you your permission, and you did, and it's really good. And let me just go through a few things here, because you say that overwhelmingly about 81% of the healthcare economists agree that the Affordable Care Act, Obamacare's individual mandate, which makes people have to pay a fine if they choose not to be insured, was essential to the success of the Affordable Care Act, and that without it, what happens?
Well, the thinking was that without it, people wouldn't sign up for coverage until they needed it, and therefore you'd get just like the sicker people enrolled, which would drive up premiums and costs, and you can get a whole death spiral thing where markets collapse. And there was a real concern about that. The mandate was effectively removed as of last year. There's no penalty. So like, if you don't enroll now, it's not like you pay a fine or anything. And markets seem to keep going. Like, enrollment did go down a little, but there's no crisis. And so it demonstrates one of the things economists expected actually didn't happen. Adverse
selection did not occur yet.
Well, it may have occurred somewhat, but it didn't occur in a way that destroyed the market.
The most popular feature, and you read about this, of the Affordable Care Act, and this is the one, Austin, that of course most Americans have heard this phrase when it comes to healthcare conversations: pre-existing conditions, that the idea that insurance companies can't raise your rates, your premiums, if you have some kind of genetic issue or any pre-existing condition, that idea is overwhelmingly agreed upon with healthcare experts that is needed. It's not only the morally right thing to do, but it's the economically right thing to do.
I'm not sure if this is so much. I mean, we really can't tell how economists are responding, whether this is like, oh, this is good economics, or this is just morally correct. I think.
I guess it would be better economics to just turn away every sick person. It would be morally reprehensible.
It depends what you're trying to optimize, but I think probably you can interpret this as, we can have functioning markets, health insurance markets with this feature. It is possible, and therefore we, as economists, broadly endorse it because it is also like the right thing to do. I mean, it's not people's faults that they get sick, by and large, and so we shouldn't punish them for it. Why should we?
Well, that brings us to the next question. A lot of people do believe that people are sick because it's their fault, that they made unhealthy choices. So why should I have to pay insurance for that guy who's over there smoking and eating fried food all day, every day, fast food, and he's, weighs 350 pounds? Why should he's made terrible health choices. I have not. I exercise. Yeah. I'm in great shape. Yeah. So what about that?
Yeah, there's a lot of layers to this onion. At one level, yes, choices and what you do in terms of eating and exercise and smoking and drugs and all that stuff are going to matter to your health. Now, first of all, even if that's completely true, and I'm going to come back and show you and talk about why it's not totally true. Even if that's completely true, that is not all of health. Like the fact that you get, a genetic disease is not due to any of that. The fact that, if through no fault of my own, I contract coronavirus, that's not because, I did anything. It's just because it's literally
you didn't keep your social distance. It's your fault. I mean, people will blame you.
Food shop. Yeah. Yeah. So, we all do the best with what we're given. Now that's exactly my next point, which is, there's a lot of the more like modern thinking about a lot of behavior is that it is not all like personal autonomy. It comes within a context of, your social context, your upbringing, your privileges. Like I am privileged to be able to like work out in my own home during this time, or to go to a gym at other times, to afford, healthy food and so forth. And others are less so. And that is not all they're doing. Like that just comes from a history of, a lot of things, structural problems, racism, educational history in their family and so forth. So it's complicated.
I probably have similar privileges, but I always have thought, seriously, the privilege I have the most is I have been privileged with, and although it's slowing down, the metabolism of a gazelle. Like
I am jealous.
The metabolism is on a spectrum. I didn't. To some extent, you obviously can affect it in terms of your exercise and eating and upbringing and understanding relationship with food. But really, it's on a spectrum like everything else, whether or not you burn calories faster and so on. So the idea that you are, what about, though, incentivizing healthy behavior, disincentivizing unhealthy behavior? You read about the sin taxes that we've seen levied. Is that effective? Does it work to charge a tax on sugary drinks, which is not only sodas, it's fruit drinks as well, as we've learned, but also cigarettes, et cetera?
Yeah, I mean, cigarette taxes do work. Look, if people have to put out a lot more money to feed an addiction, it like nicotine, it's harder for them, and by and large, it's going to help motivate them to say, "Hey, look, I got to quit, not just because it's bad for me, but because like I can't afford this." Alcohol taxes can do that. I don't know about it. I don't think we've seen like the right kind of tax on sugar. Sugar is not that healthy, but we've seen like soda taxes, which basically people say, all right, fine. Either they're very small, or they say, okay, I won't buy the soda, but I'll buy like the fruit drink, which is just as much sugar,
right?
If not more. So
I think that's what goes back to your point about in the article about being uninformed. I think a lot of people don't know that about orange juice versus Coca-Cola.
Yeah. Drink water.
Yeah, as much as you can, for sure.
Yeah.
All right. What do the healthcare economists that you are hanging out with at this conference and in this survey think about the idea? Well, first of all, what are block grants? Why do Republicans and conservatives always seem to propose block grants to states for their Medicaid funding? How does that work, and what do healthcare economists think about doing that to bring down the cost of healthcare?
Yeah, so traditionally, the way Medicaid works is that states spend money for typically low-income people for their health care through the Medicaid program, and then the federal government matches that money to some extent, like a 55% match, an 80% match. It varies by state depending on the economy of the states and the demographics and so forth. So the long-term thinking, particularly among conservatives, is that, hey, that's just an open tap from states. Like they spend $1, we give them $1, or 80 cents on the dollar, whatever. And that doesn't incentivize states to innovate, to be more efficient, to do care for less money and so forth. That's just like I said, an open tap. So the block grant idea is like, okay, let's not just say it's open-ended, but give you a fixed amount. Like you state, you get $1 billion this year, do what you do, And the idea is that would motivate innovation from the conservative point of view. From a more liberal, progressive point of view, the idea is that states are going to say, hey, great, $1 billion. Let's just cut the program to that level and not worry about the fact that we're not providing all the care that people need. There's a deep concern about that. That's a background.
Yeah, that's a really, everybody should look into block grants. But over 70% of the economists polled said that's a bad idea. That
reflects among economists much more concern about states basically making their program cheaper by just cutting who gets to enroll or the benefits they receive. This is like innovation in a way that most people wouldn't think is good. Yes, if you want to motivate, there probably are some valuable innovations states could do, but the easy innovation is just to cut the program.
The other one, this idea I find reprehensible. The Trump administration and other Republicans and conservatives have been proposing this for a long time. It goes back to this ideology that you're unhealthy and you're poor because you're lazy. This idea that there should be work requirements as a part of getting health insurance paid for if you are someone who is living in poverty or someone who is on Medicaid. Work requirements. Explain what that idea is. And you guys overwhelmingly, healthcare economists, think this is a bad one, right?
Yeah. And it's a little bit complicated why. Work requirements are like, hey, you don't get this healthcare benefit, the Medicaid program, for example, unless you show that you are working or doing equivalent community service, or you have some exemption and a health hardship, or you have to care for your kids or something. But basically the idea is, why should society, quote, give you a handout unless you're helping yourself through making an effort to get a job? At face value, I sort of can see why people be like, hey, yeah, if they can work, they should work. I sort of that's what I tell my kids too. Hey, if you can do this, you should do it. Yeah. The problem is that actually, when you look at the statistics, and it's actually a minority of Medicaid enrollees who actually can do the kind of work that would be required of them. Then you look at the economy. When the economy is bad, there may not be work for them. Then you look at the administrative cost of actually keeping track of who's working and who's not working, and are they meeting the requirements? And that is overwhelmingly complex and costly, and it overwhelms the cost benefit.
It doesn't make sense to just keep track of the people who are not working is going to cost you more than giving them health insurance. So if you're a fiscally conservative person, there's your answer. Stop with the personal judgment.
Yes, even if you love the idea, you should stop and say okay, I love this idea. Do I love it enough to waste money on it? I think most people are no, that's stupid.
It's so craven. It's so gross to think that you're going to hire people that are going to look over someone's shoulder to see whether or not they're working. You're going to pay someone to spy on someone whether or not they're working to see if they should be able to have health insurance. Gross.
So that's the economics of it, but it turns out there's actually a lot of legal problems with it. It's all tied up in the courts now. I don't believe it's being implemented anywhere, or I may be missing a state, but basically there's a whole bunch of lawsuits, and it's just not happening in most places because it's not actually, it doesn't follow the actual statute. It's illegal, apparently. So
what about drugs? You write about the cost of pharmaceutical drugs, and it's very interesting, the healthcare economics behind this one. If you care at all about economics, and even if you don't, Austin writes and talks in a way that you don't have to be an economist, but the price of drugs, the idea that private pharmaceutical companies should, competition creates innovation to come up with the best drugs and treatments. Yet we all know that there's millions of Americans that can't afford to get their drugs. And now I think even certain states, did I read this, are incentivizing them to go to Mexico to buy the drugs, or rather certain insurance companies, I think. I read about that. But either way, what about the cost of drugs, and what do the healthcare economists say about what can be done about that, or what should be done in a perfect world?
Yeah, so this is the issue of if drug prices are higher, not because of competition, but because we give them patents and so forth, and they're just sort of monopolistic pricing. Basically, we give drug companies a monopoly if they have an approved new drug from the FDA, and we say, fine, you get to sell that, and nobody can compete with you for so many years, and they can put the prices basically anywhere they want. And so the question is does the profit from that high monopoly price setting incentivize innovation? And so there's this concept of the profit innovation trade-off, and it is a real thing. I mean, if there were zero profits, if there's no profits in making drugs, people wouldn't do it. Nobody would invest in it. So there has to be some profit. The question is how much value do you get for additional profit? That's a very difficult question. Economists are struggling with it. The question put to the 200 health economists was a little bit, in my view, a little bit unfortunately worded. I think it was something like, you may have the wording there if you have my article, but something like, does the profit that companies get optimally encourage them in innovation or something like that? It was a bit more nuanced than is there a trade-off, or it was more is it optimal? And I think, was it a slim majority said it wasn't, or I'm forgetting.
I'm looking it up right now. I had notes I copy and pasted from the New York Times article into another document, and everybody should just go read this article where Austin did a lot of research and printed it in the New York Times. Check it out.
I can summarize. Basically, it seemed it was a little bit not square on this issue, but it was enough to say it looks like many economists, maybe it was a small minority, are skeptical of some aspect of this, but it wasn't a full-on endorsement of pump up the profits, that maximizes, innovation, and so it was something.
Are the current levels of pharma company profits necessary? 48% say no, 28% say yes, and 24% said they don't know. Interesting.
Yeah.
All right.
Yeah, so almost half said they weren't necessary for optimal innovation or something like that.
There's a bunch more in here in this article that people should read about. But before we wrap, I do have to ask you about what the most unpopular way to reduce healthcare spending is. And you write, employer-sponsored health insurance is not subject to taxation. And I guess I didn't realize that. And I'm not sure how it works with employer-based health insurance. I mean, employer-based health insurance seems to be the root of all of the problems with our health insurance system in the U.S. whenever they came up with that idea back in, 2 generations ago, World War II. Yeah. So why is that the most unpopular way? Because it's a tax increase?
Yes. If employer-based insurance were taxed, either we would have less income because employers would have to pay the tax and they wouldn't give us as much income, or they would reduce benefits. So I would have higher copays and higher deductibles and stuff everybody hates. But it's a huge tax benefit to employed people. Obviously not all employed people are wealthy, but some of them are. And it's something in the hundreds of billions, $200, $300 billion effective loss of revenue to the federal government and state governments actually, because they don't get taxed.
So read Austin at the New York Times and the blog, The Incidental Economist, where he co-founded that with our friend Dr. Aaron Carroll, and follow him. He's a great follow on Twitter. I know him pretty well. He's a really good, smart, thoughtful guy, family man, and he's dealing with all of this and tweeting about it, and it's helpful. I like following you on Twitter. That's Frakt, AFRAKT. Austin, thanks for talking to me. Really interesting, important work that you guys continue to do, that you're continuing to do. So thank you. We'll talk to you again soon.
Thank you.
All right, that's it for episode 66. I'll probably put out 67 over the weekend. I've interviewed a whole bunch of other people that I want to share with you. I'm just going to keep pumping these out. I'm not sure about the schedule and how it's going to work. Everything in my life is up in the air, and I'm trying to do this as much as I can and video it and get it all up. I'm a one-man team. I appreciate your support. Join me on the happy hours, and all you have to do is pay as little as $5 for a subscription on Patreon, patreon.com/Pete Dominic. Right now, we're doing one Friday the 20th at 9 p.m. That's tonight. If you're listening right now, there's only a few hours left after I post this, I'm sure, but I'll be doing them randomly and regularly as well as posting this. Go to youtube.com/standupwithpete to see video of most of the callers and my guests. And I'm going to hopefully be able to continue to do that and continue to start going live on social media as well. So follow me on the social media, and I will talk to you later. Stay safe, support each other. Love will get us through this.